Uh, Finally, so I'm very pleased to introduce Jehaan Kotwal and Sumit Mane today to everybody. Mr. Mane and Mr. Kotwal founded the Humsafar Driver Safety Foundation, which provides technological solutions to prevent road accidents in large truck transports. Mr. Kotwal is a serial entrepreneur with vast experience with startups, led him to found JFK Transporters, a trucking and freight company whose work has recently been critical to transporting oxygen to healthcare centers in India for COVID patients in critical condition. His work with JFK Transporters earned him the Youth Transporter of the Year award by Ministry of Road Transport and Highways in 2016. Mr. Mane is an experienced product management professional whose prowess is IT and computer science and has allowed him to work at a number of tech companies as an analyst, app launch team leader, and app designer. Welcome, Sumit. Welcome, Jehaan. The floor is all yours.
Thank you. Thank you, Priyanjali. Good morning, good evening to everyone. And thank you so much for giving us this opportunity to talk about what we're doing. Let me just begin with, just sharing a couple of incidences that we've experienced over the last few weeks. My own staff members, and we move oxygen for almost all the big, oxygen companies across the country. And Altaf, who works with us, unfortunately got COVID, immediately rushed to UP. And when I called him and we were asking him, what do you need? What can we help you with? He was asking for just one cylinder of oxygen, which, as even though we transport oxygen, for us was difficult because we don't do it on that side of the country, and we tried our level best. And eventually he was able to get one tank of oxygen for maybe a few days after spending 70,000 rupees, which is almost more than 2 months of his salary. And it took him 3 days to procure that tank, and as well as make sure and refill it for, excess amount of oxygen as well. So this kind of experience and such experiences over the last few weeks, we realized that actually the challenge in India, like Sukhmeet was mentioning, as far as oxygen supply is concerned. So we did a lot of research just to give you the stand around, and how do we make the oxygen supply more efficient in the country. Currently, as far as manufacturing is concerned in India, we have a lot of oxygen being manufactured. The problem is not the manufacturing of oxygen, it's actually a supply chain issue, which means that the cryogenic tanks in which these oxygens are moved need to have a faster turnaround time to be able to reach the hospitals or these oxygen centers. So essentially, what our role is, we're working with the Ministry of Commerce and the Logistics Skill Council. And what solution we had, and we have the technology available to do this, and hence we immediately leveraged the road safety technology that we had, and we pushed it into the oxygen trucks, movement. Essentially, what we are doing now will be a mobile application that goes onto the truck drivers' phones, which insures them, incentivizes them, and also will be helping in their vaccination. Now, why are these truck drivers who are moving these oxygen cylinders important? And how will it improve efficiency, and what can it result in? Last 2 weeks ago, we had about 11 deaths in AP due to a half an hour delay in the oxygen truck reaching the hospital. In April, we had 24 deaths just because there was a leakage in oxygen in Nasik. These kind of incidences that are just very few reported, just by the way, that's one thing which we are very unfortunate to see, is that we don't see a lot of the bad stuff here, and it's quite subsided with the numbers like, doctor was talking about as well. And so we're going to see, even probably in the third wave, far more of these incidences around, oxygen supply. And so how do we, close this, and what is the solution for the challenge? What we realized is that these 2,000 tanks that run across the country, if we could increase the efficiency of all these tanks by even 5%, that leads to a 300-ton excess capacity per day, which can save about 2,700 lives a day. And I'm talking about ICU patients. Now, essentially, to really, really go deep down and understanding the root issue, as I was mentioning, is the supply chain, right? But what was more important is the guys who are driving these trucks to these hospitals, coming back, probably working not less than 16 hours, and are the hidden frontline warriors, mind you, in this whole battle, completely neglected, not insured, not looked after, not even respected for the work that they're doing. And essentially, our role, as a foundation, is to work towards not only giving them that extra, slight incentive. So we've made it on a per kilometer basis. We, give them 30 paisa per kilometer, which is hardly, if they're running 10,000 kilometers a month, it's hardly 3,000 rupees in their pocket. But for them, that's a big deal. And so that 3,000 rupees extra encourages them to drive a little bit more, maybe that 5% more, do that extra delivery, do that extra pot of oxygen. So that's one smart way which we've figured out on how to incentivize them. The second thing what we've done is also making sure that they're insured. Because the thing is, these drivers across the nation, and especially this is critical for the third wave, these drivers, if they need to be trained, it takes a month. And if there's a shortage of these drivers, obviously there's going to be a lack of the, again, the transportation is going to get affected because training them is an issue. So we're also trying to bench about 500 drivers across the nation as well, to make sure that they're at least kept ready, and in case the third wave hits us, they can be mobilized immediately. Simultaneously, of course, vaccinations, a challenge across, at least for us in the West, and we're seeing this predominantly, is the vaccination not being available. And so hopefully when that does open up, we plan to do a much bigger vaccine drive for them and immediately get them vaccinated so that they can keep doing their duties and making sure that oxygen is supplied across the nation on all the hospitals. That's essentially what we're doing. We're using technology in terms of, it's a mobile application that's easily downloadable. It's very scalable, very fast, efficient in terms of transparency. And we're making sure that the drivers are taken care of from an insurance point of view. So these are the three things. I would have loved to share a presentation, but due to a shortage of time, maybe if any one of y'all are interested, happy to do that. But thank you so much. And any technology questions, Sumit is our tech product lead, so please, you're free to ask him those as well.
Thank you, Jehaan. Thanks for your wonderful insights and talking about the frontline warriors, the truck drivers who are playing such a critical role during COVID-19.